Thank you for participating in today's training. The recording will now begin. Allison, you have the floor.
Beautiful. Hello, everybody. My name is Allison Berriman, and I am a partnership specialist serving in Reno, Nevada. Kevin, do you want to introduce yourself?
Sure. My name is Kevin Staley. I'm a partnership specialist in Portland, Oregon.
Beautiful. So Kevin and I will be leading you all through the next 2 hours of training. And we're going to be talking about what partnership has done up until this point so that you can kind of better understand who you're working with for this MQA operation and just get a better understanding of this whole program and the partners that we're working with and all of that. So as partnership specialists, we collaborate with organizations and businesses and governments to create partnerships across our respective regions. And the idea here is that we are working with trusted voices in our community to try to improve the self-response rates to the census. So today we're going to talk about a number of things. I want to do a little bit of an overview of just understanding where partnership falls into the bigger 2020 census plan to sort of orient ourselves. I also want to talk about our strategy and partnership of who we decide to make partnerships with and why. And that includes a focus on hard-to-count populations, which we'll define as we move forward. We're also going to talk about complete count committees, which you will, again, hear more about, but at its most brief, this is going to be a discussion about how we organize our partners to work with each other to increase self-response. We're also going to talk about the community-based organizations and how the Census Bureau works with these organizations. Community-based organizations just being organizations in communities. However, we'll talk, of course, more in depth about that. We're also going to talk a little bit about how the states are participating in improving self-response and how public institutions such as schools and libraries are participating. And then we'll end with a little bit about some of these, what we're calling partner-led questionnaire assistance. So while you will be participating in MQA, which is, of course, the Bureau-led initiative to do questionnaire assistance, some of our partners are doing something similar. So we'll talk a little bit about that. I also want to note here that after every sort of topic that we discuss, I'm going to allow a little bit of time for questions from the audience, as well as to allow Kevin to interject and add anything. And about halfway through this presentation, we'll switch and Kevin will take the lead.
Allison, this is Kevin here. We already actually have a question about whether and how the partnership specialists, do we work with tribes as well?
That's a great question. So partnership specialists, so there are, I guess, different branches of partnership specialists. There are partnership specialists who are specifically trained to work with tribal governments. So myself and Kevin are not those partnership specialists. We just work with non-tribal partners. The partnership program respects the sovereignty of tribal governments and therefore has a different way of dealing with tribal governments. So yes, partnership specialists do work with tribes. It's partnership specialists who are particularly trained in that area. Okay, so this big, somewhat confusing looking web in front of you. This is meant to represent the larger umbrella under which partnership exists. So partnership specialists exist under the 2020 census's more general integrated partnership and communication plan. So partnership is under the same umbrella as things like the website development, the 2020census.gov. We're also under the same umbrella as a lot of the advertising, the commercials, all of that stuff that's getting made, the social media pushes, as well as a program called Statistics in Schools, which we'll talk about later in this presentation, but it's basically just census data being sort of put into schools to promote the census there. In any case, we exist under this larger umbrella of public communications. And then we work sort of collaboratively with all of these aspects of the Integrated Partnership and Communication Plan. But the purpose of this overarching umbrella that we exist in is to increase the self-response rate. So that just means basically, most households, of course, as you're probably familiar, have received an invitation to respond in the mail, asking them to respond whether online or over the phone or by the paper questionnaire. And it is the goal of the Integrated Partnership and Communication Plan folks and all of these sort of things, the programs existing under this umbrella. We are trying to get more people to respond to these so that we don't have to send as many resources to go door to door to door and repeatedly ask people to respond. So that is our overarching goal.
We got another question already here.
Great. Give it to me.
The question is whether the CRRs will fall under field recruiting or partnership program. I'm curious if you would know the answer to that.
Well, so my understanding is that the CRRs are under a separate umbrella, and that's the field operations umbrella. However, there is a close relationship, a marriage of sorts, between operations and CPEP or under with communications. So they are separate hierarchies, but we are now working together towards the same mission. So it's kind of an unclear answer, and I apologize for that, but it's because it's complicated. Do you have anything to add to that, Kevin?
No, that's great. I think that you totally nailed it. I'm actually going to talk about the marriage, the quote-unquote marriage between, the ACOs and the partnership program a little bit later. So, yeah, great job. You nailed it.
Awesome. Okay, so as I said, the overall mission of the communications umbrella, if you will, is to increase self-response, but partnership has a little bit of a more specific objective or set of objectives. So you'll see this acronym here and there, CPEP. Apologies, there are many acronyms that exist within the Census Bureau and the federal government more generally, and I know that can be somewhat disorienting, so I try to avoid using the acronyms where possible. But CPEP, for reference, stands for Community Partnership and Engagement Program. So that's partnership. You can kind of use them interchangeably. So the CPEP or partnership objectives, more specifically, our goal is to engage community partners to increase decennial participation of those who are less likely to respond or who are often missed. So kind of sitting on that one for a second, right in there, in the objective, we're talking about reaching out to community partners who serve folks who are less likely to respond. So we have a focused objective and mission. It's not just get everybody to respond, right? We're trying to be more purposeful, more intentional in the communities that we're doing outreach to have the most positive impact that we can. And we work to fulfill this objective in three primary ways. First, partnership educates people about the 2020 census and fosters cooperation with enumerators. So what that means, to kind of put that into the real world, is basically partnership specialists go out and we give trainings, we give presentations, we take meetings, and we tell people about what the census is, why it's important, how to respond. We talk about the timeline. And then we try to understand what some of the barriers to participation might be for certain communities. So that's that whole piece about fostering cooperation with enumerators. So there's a million different reasons, and we're going to get into that later on about why people might be less likely to respond or might not, quote, cooperate with enumerators. But for like a brief example of that, it might be just a gated community, right? So we need to get the gated community to cooperate with the census and allow us to come in. So that's something that a partnership specialist might do. They're going to go and they're going to talk to that apartment manager and tell them about the 2020 census, why it's important, and get them to open the gates, if you will. We also work with community partners to encourage folks. So we are working with community partners to motivate people to self-respond. So that's, I guess, very clearly under the larger communication umbrella, right, the self-response. That's what we're hoping for. So when we're working with community partners to motivate people to self-respond, that looks like a ton of different things. Partnership specialists' job is to meet those community partners kind of halfway and collaboratively come up with ways that that community partner might be able to help motivate their community. So that might be through social media or through paper flyers or through events or really creative solutions. But the idea is that we want to get the partners to be motivating their own communities rather than us having to do direct outreach to every single individual. We're sort of the organizers with the partners, right? And the third sort of sub-objective is that strategies that we use to fulfill this objective, rather. We engage with grassroots organizations to reach out to hard-to-count groups and those who aren't motivated to respond to the national campaign. So that's really important. The Census Bureau has done a ton to try to target its messaging to as many different populations as possible. We try to be really inclusive in our messaging and intentional about that. But within that, you know, some populations require additional outreach. And it's also the case that you can't, like on a national level, it's unlikely that we're going to have an outreach campaign that was specifically targeted to every type of complex, diverse individual, right? So that's where the partnership specialists come in, where they reach out to grassroots organizations who are closer to the ground and more involved in their communities and the diversity of every specific location and demographic and all of that. And so we work with these organizations to reach out to the folks who might have been otherwise missed in the national campaign. Before I move on, Kevin, do you want to add anything there, or do you have any questions?
We don't have any questions right now, but well done. I'm going to talk a little bit later, too, about the trusted voices and how we've leveraged them from these grassroots and community-based organizations. So great setup. Thanks.
Totally. Yeah. That's a key part you're going to hear again and again. Trusted voices, because that's really the idea. Like I said, we're not trying to, the Census Bureau, it wouldn't make probably very much logistical sense for us to try to reach out to every single individual, you know, like on a personal level. But that's why partnership exists. Partnership exists to create partnerships with trusted voices, leaders in the community who can reach out directly, right? So we're creating a whole web. So yeah, we'll come back to that. This next slide here, we're looking at hard to count. So I've probably thrown that phrase out a couple times already, and it comes up all the time because the Census Bureau is, like I mentioned a couple slides back, partnership is intentionally trying to reach out to the folks who are most likely to be missed. We're really trying to concentrate our efforts. So the center of most everything we do is focusing on hard-to-count populations. You might also see this as an acronym, HTC, but for the purposes of this, we're going to really try to say the words hard to count. So it's really important that the census counts every single person because a lot of important decisions are made using census data. If we don't count everyone, then decision makers don't have the right information to make good informed decisions, right? You can't make really well-informed or really good, solid decisions that are good for everybody if you don't even have the information to do it. So that's what the Census Bureau sort of acknowledges and works towards. And within that, though, some people are easier to count than others. When the census misses members of hard-to-count populations, it can mean that these groups don't get the representation that they deserve in government, and it means that the public programs designed to serve these populations might not get the funding that they need. So it's really important that we go out of our way to try to include as many people as possible so that everyone gets representation. That's, all about democracy, and that they get the funding that they need. So to ensure the quality data about the population, the Partnership Program, or CPEP, focuses on reaching out to those who are most likely to be missed. So, and we have identified 4 reasons that might make a population hard to count. So the first one being that a population might be hard to locate. So a population could be hard to identify because of stigma or because they move often or because they don't have a home. So if we can't find a person, then that's going to be obviously hard to count them. They might be, a second reason might be that the population is hard to contact. So once located, some populations could be hard to access. So that comes back to the gated communities, right, that I mentioned earlier. Or, again, homeless camps. So you can start to see, even just by these 2 things, sometimes a population is going to fit into 2 categories or more. And then that person is going to be even more difficult to count. So we'll work with hard to locate, hard to contact, hard to persuade populations. So those are people who, once accessed, might be reluctant to participate. So that's going to be folks who are, for example, just too busy. I mean, you can imagine your family, maybe there's a single-parent household, they work 3 jobs, they've got 4 kids. They've got a lot going on, and so they have priorities. And if they don't understand that the census is going to directly serve them or benefit their community, then they might be less likely to respond. So it's Partnership's job to sort of try to identify those folks and reach out and communicate to them why it's important. The other thing that might be hard to persuade are the politically motivated. And this is something that comes from all sides of the aisles, any kind of political background, just folks who are skeptical of the government for any number of reasons. That kind of harkens back to the question about tribes. So, of course, historically, there has been conflict between tribal governments and the federal government, and so those are sets of relationships that really need nurturing, and these populations might be harder to persuade to respond. So we're going to focus on those populations. And the 4th reason that a group might be hard to count is if they're just hard to interview. Folks who, even though they want to respond, there are some barriers to do that. So once engaged, it's difficult to communicate with them. For instance, maybe language groups who don't have like a common language spoken or who have a disability. For example, maybe somebody is blind, so they don't, when they receive the invitation to respond in the mail, they don't necessarily see that, right? So we need to do outreach that engages with folks who are blind or folks who speak a different language. We need to make sure that we're reaching out to different language communities and making sure that people of all different backgrounds hear the message and know how to respond. So that's a little bit about that. Do I have any questions before I move on?
Not really at this point. Great job. That's a great, those 4 reasons are so true. I love seeing it written out like that. And I agree completely. Thank you.
Yeah. So here I'm going to talk just very briefly about some of the hard-to-count populations that have been identified. This is absolutely not inclusive of every group that might be challenging to do outreach with, but these are just some of the groups that historically the Census Bureau has been intentional about doing outreach with because they're considered hard to count. And some of these, of course, now that we've discussed these 4 reasons that people might be less likely to respond, you can kind of map those reasons onto some of these populations, right? People who are experiencing homelessness, they might be hard to locate, right? And they might be hard to contact. They might also be hard to persuade, right? And if they're suffering from certain disabilities, then they might also be hard to interview. So you can see like immigrants / people who are foreign born. That could be a lot of different reasons, depending on from where people are coming. Some governments are not democratic. Some places, if you're from a country where it's not safe to trust your government, that you don't want to be willingly sharing your information with the government, they might not understand the purpose of the census and might be hard to count. So we need to do intentional outreach with these communities to communicate, you know, what the census is here and why it's important and what protections exist for people who are responding to the census. Senior citizens might be difficult to contact for a number of reasons, depending on what their living situation is, if they're living in a group situation, a group home, or, you know, perhaps they don't have always the same internet connectivity as younger folks. But in any case, these are a selection of some of the populations that we work with. And so what partnership specialists will do is they'll go out and they'll think, okay, veterans, we understand that for whatever reason, veterans are hard to contact or are hard to get to participate in the census. So then partnership specialists will go out and try to find all the organizations who serve veterans and build relationships with those partners and make partnerships out of those organizations to figure out and identify what is it about veterans that makes them less likely to respond, and how can we address those challenges? How can we do outreach in a way that considers those concerns or those barriers? And so we do that with each of these different groups, as well as a number of other groups. And it's also important to note that, oh, yeah, go ahead.
No, I'm sorry. We have a question. It was about whether or not there's anyone that should not be counted. I know this is kind of potentially a big answer, but do you have a general answer without getting into residency requirements or anything too much? Are there any people that we do not count?
I guess it's easier to say who we do count. It's easier to say that we count everybody living in the United States.
Awesome.
So we want to count everybody once, only once, and in the correct place. So, and of course, it gets a little bit more complicated than that with some of the residency requirements. If people are traveling and stuff like that, we really don't need to get into that level of nuance. If you live in the United States, regardless of any other factor, if you live in the United States, we want to count you in the census.
Well done. Perfect. Nailed it.
Actually, one other thing I do want to add about the hard-to-count populations is, so the Census Bureau has identified some groups, including these and others, who are considered hard to count, but also part of the partnership specialist role is understanding their own communities and how each community is diverse and has different needs and different barriers. So if I understand that in my community, a certain population is going to be hard to count, but for whatever reason, maybe isn't hard to count in some other area or hasn't been identified by the national level. That's the expertise that the partnership specialist brings about their own community and building those relationships and kind of thinking outside of the box, as well as working to identify and create partnerships with the pre-identified groups. So I've talked a lot about hard to count populations and sort of like these identifiers about a person that might make them less likely to respond. And so, of course, we're working with the organizations who serve those folks, but we also, beyond thinking in demographic, through a demographic lens, I guess, we're also thinking about geography. We're thinking about areas of the country where people are less likely to respond, or areas of your city that people might be less likely to respond. So this map that you're looking at, it's from a program called Rome that the Census Bureau made. We're not going to go super into this. You're going to have a whole another presentation where you just learn about Rome. But for now, all you really need to know is that the Census Bureau has this program. It's called Rome. And on it, you can see sort of the areas that are the darkest blue. Those are the parts where people are expected to have, it's, I guess, the low response areas where the fewest people are likely to respond are dark blue. So, and then when you like zoom in on your location, you can see really specific data about your city or your place. And so using this information, partnership specialists will build partnerships in harder to count areas. So while we are, of course, working with trusted voices in hard to count populations, we're also building partnerships in hard to count communities, like geographical, physical communities, right? So this is allowing us to reach locations as well as by demographics. And this is a really cool tool because it gives you information, and you'll, like I said, you'll learn more about this in the future, but you can learn some pretty specific geographic information about what makes a place hard to count. So that's pretty cool. Like I said, I don't want to go too much into this. You're going to hear plenty about it in the future, but you should just know the takeaway here is that we work both on a location-based strategy and a population-based strategy. Okay, I'm going to switch topics a little bit and start talking about complete count committees, but before I move on, if there's any questions about the low response areas or the hard to count populations or CPEP, this would be your opportunity to bring that up.
Yeah, Allison, we did have one question, kind of group quarters related. I know that the day 6 training is going to touch on this a little further, but it's just good for folks to know right now. But the question is, how do we count college students now, since most of the colleges' campuses are closed to in-person classes because of the COVID-19 outbreak?
Yeah, great question. So historically, or not even historically, we count folks who live in dorms through a group quarters operation, which you'll learn more about. But we work with the dorms or with the university to get those counts. So there are a number of different ways that we enumerate people we count people who live in dorms. And some of those methods include in-person interviews or electronic response. And I'm not entirely clear on exactly which methods are usually used, but I do understand that because of COVID-19, we've changed it a little bit and a lot and expanded the options for universities to respond on behalf of the dorms. So, for instance, now a lot of the universities will just be providing the Census Bureau with administrative data on, I'm not sure if that's the correct term, but essentially they have records of the folks who live in the dorms, and they'll submit that to the Census Bureau, and that will work as the count. Do you have anything to add to that?
No, that's pretty much right. Yeah, it's my understanding as well that we're still counting the students as if they were living there. That's a question that I've gotten many, many times via email from various partners over the last couple of weeks. And I'm assuming the Census Bureau is getting a lot of calls about that as well, since people have kind of upended their lives and moved back home. But yeah, we're still taking that data from the university since that is where they've been living and sleeping most of the time.
Right, and that I guess applies also to folks who had been going to school like on campus, and then because of COVID and school closures, they might have been staying. They might have moved back home with their parents temporarily, but because it's temporarily, they haven't actually moved there. They would still, by the census, we're counting people where they live or stay most of the time. So folks, college students, you might hear this at MQAs and stuff, so it's worth stating that college students, even though they might have been at their parents' house on April 1st because of COVID-19, that's still not where they live and stay most of the time. Where they live and stay most of the time is their house or their apartment or whatever, their dorm on campus, right, or near campus. Okay, so I'm going to move on a little bit to another way that we are reaching hard-to-count populations / just generally working towards our goal of increasing self-response, and that is through complete count committees, or they're also referred to as CCCs, again with the acronyms, but here we are, complete count committees. So over the last 2 or so years, partnership specialists have been working across the country to form complete count committees, also known as CCCs. These complete count committees are comprised of a broad spectrum of government and community leaders that work together to promote and encourage a complete and accurate count. So basically, we're getting our partners together and having the partners create their own little task forces to promote self-response. There's a bunch of different kinds of CCCs, or at least a few kinds of CCCs. And some of them are at the higher, like the governmental level, right? Those are state CCCs. I'll get into that in a minute. But a lot of them are just, regular, I don't know what I mean by that, regular partners, but they're just community partners and city officials and county officials and all of that, just like lower level or closer to the community level folks, all getting together and organizing. So yeah, like I said, this has been happening since like at least 2018, maybe even earlier than that. This map that is on the screen, all of those blue dots are the known complete count committees. I'm not sure exactly when this graphic was taken. I'm sure there's probably more than that even now. But it kind of maps out where these committees exist. I'll talk a little bit, I guess, about each kind of complete count committee because the role of the partnership specialist varies a little bit. So we'll talk first about state complete count committees. So these are the folks who are at the highest level in each state. So these committees are usually comprised of elected officials and also some folks who are appointed to the committee by or invited to the committee by elected officials. So these are, so for instance, these vary so much, it's almost difficult to talk about because state by state, they kind of do their own thing. So for example, in Nevada, the state CCC, or State Complete Count Committee, it was established officially by the governor, but then the chair is the lieutenant governor, and then the governor appointed all of these different people who were on it, and then they created a budget. So the Nevada State Complete Count Committee is like very official. It's designated by the governor. It's chaired by the lieutenant governor. It came up with a $5 million budget, and they're all working together to do partnership activities, or not partnership, but I guess outreach activities on their own. They're organizing their own events. They're organizing their own outreach campaigns. They've drafted and adopted various proclamations. So they're really kind of an outstanding state CCC because not every state has a budget. Not every state has the governor appointing folks or officially recognizing the census. It's really up to the states to decide their level of participation and their level of commitment to the census. But like I said, within Nevada, they've done a lot. They even hired, like the state CCC, they created a bunch of different subcommittees, and those subcommittees all focus on a hard-to-count population. The state CCC made a budget, which then they hired a whole team of people to go and to operate like partnership specialists and to operate like CRRs, to go out there and do questionnaire assistance and to do partnership outreach and all of this. So, but like I said, not every state does that, and it really varies. And I would recommend, and I think Kevin might talk about this a little bit later, but I would recommend when you're doing the MQA and you get to meet your partnership specialist, asking them about the state participation in your community and in your state to understand sort of their role and their level of interest. Because in some places, like the state of Nevada, if you're doing an MQA, it might be the case that you get a state representative coming up to you and telling you how they're on the CCC, or you might have somebody who works for the state in partnership coming up to you and talking to you about it. So it would be helpful for you, so that you're not confused, to talk to your partnership specialist and understand your state's participation in the census, and to kind of orient yourself around that, so that you might have some expectations, so you don't feel silly when someone asks you questions or assumes that you know something about it. So the partnership role on these, though, is kind of a roundabout way of getting to that. But the partnership role, I think I've made it fairly clear that these are state-run, essentially. They are at the state level. The partnership specialists often, if not always, have a role in creating the CCC, right? They're working in partnership with state officials to encourage them to create these state CCCs. They're doing the training with the complete count committees to tell them about what a complete count committee is, give them some ideas about how they might organize subcommittees or what outreach efforts they might have. And the partnership specialist might attend some of these complete count committees as a bearer of information. They might share census updates, that kind of thing. They might try to amplify some of the state's efforts and support those efforts. And they have this sort of mutually beneficial relationship. But a partnership specialist is not on the CCC. They're not on the state complete count committees this is something that we do, partnership specialists do, to motivate our state partners and our community partners to do their own outreach. So we're really a supportive and a training role. We're not leading these things.
That's a great point.
That was a little bit, scattered. So, was that clear?
No, absolutely. I agree. I was actually going to mention something like that. I sit in with a very robust CCC in Washington County, Oregon, and basically their meetings start out with a 15 to 20-minute update from myself, and then they carry it forward with their objectives and their action items and their timelines and their budgets, and they all kind of figure it out together as a team. So it's actually been very effective. So that was a good point.
Yeah, it's actually really cool to see some of what the complete count committees are doing, somewhat unprompted. I've had the pleasure of participating in as like a guest speaker a number of the state complete count committee meetings here in Nevada, and they're really they came up with this idea to adopt a statewide proclamation in support of the census. They came up with this idea to get the school districts to adopt this proclamation, and they've done, they have their own sort of MQA operation. They've done, they've convinced a bunch of, the lower, the city and county level officials to create videos on behalf of the census. They're really enthusiastic and supportive, and some of the best ideas that the census in Nevada, the census team has come up with have actually been products of the state CCC. So they're really awesome. Okay, so I'm not going to go through all of these. I just wanted to give you a concept of, because I mentioned subcommittees, and I mentioned that the state complete count committee has a bunch of subcommittees that are focused on hard to count communities. So the Census Bureau has made all of these training manuals and materials for the complete count committees to give them suggestions about how to organize or the kind of outreach that they might do. And so a lot of them, while every state is different, they are all kind of influenced by some of the same information created by the Bureau. So a lot of them will have special subcommittees or task forces, right, that focus on things like some of these groups. There might be, and there is in the case of Nevada, a subcommittee that's focused on faith-based outreach. They also include faith-based and nonprofits, so that's a little bit of a spin on it. But there might be a subcommittee just for libraries, or there might be one just for veterans, right? But basically these are just smaller groups within the larger CCC. So that makes it functionally, at least in Nevada, there's the state complete count committee, and then all of the subcommittees, they just meet independently, and they don't even meet with the larger committee, right? So it's almost like the state has 7 different complete count committees. So this allows them to have a really broad reach and a very specialized, both broad and specialized, which is pretty cool. So I already talked a little bit about what Nevada's team is doing. Like I said, they were officially formed by the governor, Steve Sisolak, in April of 2019. So we were a little bit later in the game than some folks. It includes both private sector leaders and public officials. They have a $5 million budget, which they've used to give a bunch of partners serving hard to count communities computer technology so that they can allow people to respond to the census at their locations. It's allowed them to hire a whole team of folks doing outreach. It's allowed them to print a bunch of materials and do mailers and all sorts of stuff. And there's some subcommittees are the hard to count subcommittee, the business subcommittee, where they have like all of the top dogs in business, so like casino people, like real estate people, that kind of thing, all working together. They got the nonprofit and faith leaders. They've got one for government, so that's like a bunch of city council people and county officials, and then also an education subcommittee. That's a little bit about Nevada. How did Oregon do it, Kevin?
This is pretty similar. I haven't attended a state CCC. That was kind of taking place before I came on board. Obviously, it's still going, but yeah, I think they have a slightly larger budget. I'm going to kind of get into some of the state-run efforts, kind of the We Count campaigns that are statewide a little bit later. Very general information, since it's, like you had mentioned before, the variety is pretty wide on these. But yeah, very similar. You know, the subcommittees, a very wide range of participants that sit on the CCC, the state CCC. You know, it's kind of a trusted voice from various, you know, parts of our society, and kind of being able to speak up for the importance of the census within their community. So yeah, it certainly has been successful, and you know, I know that they're setting, Oregon set aside, I think, $7.5 million for the census, and I know California, I touch on it later, I think California is about $187 million. So it's quite the operation. So as you can imagine, with that much money going in, the amount of subcommittees goes up, the amount of outreach goes up. You know, they're buying ads. You know, I saw a parked bench, or a public transportation bench yesterday that was a We Count Oregon, had a We Count Oregon billboard on it. And yeah, so you know, it's been successful, and I think it's going to pay off with our count. Yeah, good job.
Yeah, it's sweet. It's like it's an opportunity going into those subcommittee meetings or the committee meetings, and it's the same on the regular complete count committees. It's like you're going into a room as a partnership specialist full of people who have the power to make things happen. And so you can really do some high-level organizing and get consistent messaging across the board. They're cool. So, yeah, a little bit about the other complete count committees. Yeah, they've got the county-level ones. So they've got city and community. So, and sometimes these are organized in different ways. But I guess, so while state CCCs are largely attended and supported by higher-ranking partnership specialists, the rest of the partnership specialists play the same role for the county, city, and community complete count committees. So how these work varies by state and by region. In Nevada, all counties have CCCs, but only some of the towns and cities. So, for instance, the city I live in, Reno, we don't have a complete count committee. We have, the county does, and Reno is the only real city in the county, right? But so that kind of varies. But sometimes partnership specialists will also form community-specific CCCs. For example, there could be a complete count committee that was just focused on organizing LGBTQ folks. Or it could be a complete count committee focused entirely on serving people who are experiencing homelessness, kind of like the subcommittees at the state level or any level really. But so usually complete count committees are kind of at a government level, so whether it's state, county, city. But there's also diversity between states and communities and kind of whatever the partnership specialists in that area have nurtured and whatever the partners have sort of allowed to grow. But sometimes the local and regional complete count committees are integrated with the state complete count committees. For example, like Nevada, this is not the case in Nevada, but it could be the case, that within the Nevada Complete Count Committee, one of the subcommittees could be each of the counties or each of the major cities, that kind of thing. So you might have, these are kind of called like nested complete count committees. But yeah, so there's a million different ways that these are organized. But I guess suffice it to say that they're usually government level and that they're largely the same as the state in the sense that they have sort of that same organizational level. The partnership specialists also still are just acting as supportive roles, and they're also just training them. Partnership specialists are still not serving on the committees. Okay, so now we're going to kind of switch roles here, Kevin, and you're going to take over.
Go for it.
Beautiful. I'm going to have to figure out.
Let's see. Yeah, if you stop sharing yours real quick, and then I'll jump on.
Okay.
Hold tight, folks. Okay, hi everybody. This is Kevin Staley. I'm kind of taking over midway here. And Allison, great job. That was awesome. I'm impressed. Excellent. Very well spoken. So my part of this presentation, I'm going to talk about the community-based organizations kind of at the local level. And then I'm going to kind of dip into some other areas. Allison spoke about the hard-to-count communities and why they're hard to count. I'm going to kind of talk about those as well, but more about how we reached out to them in a very general way. I'm also going to talk about the questionnaire assistance centers and how that's kind of worked out, as well as a segment about schools and a segment about libraries as being crucial partners as well. But first off, we're just going to kind of talk about community-based organizations and how they can make an impact and improve the allocation of federal resources and positively influence those least likely to respond and those that are often missed in the census. I'm going to cover what a CBO is, and there's acronyms like Allison was talking about. CBO, community-based organizations, and why they've been targeted as partners. I'm going to give examples of CBOs, how they're utilized. I'm also going to briefly discuss Oregon's approach to CBO partnership. That's going to be based solely on my experience. You always remember to keep in mind that this is varied across the region, but for the most part, we're all working towards the same goal with using the same resources. It is worth noting that it's been a variety of ways, including working with the recruiting assistants and the ACOs. I'm going to talk about that as well. And then I'm going to talk about some common partnership commitments, as well as a variety of hard-to-count communities and how they were engaged. But, yeah. So the public and private nonprofit organizations were targeted because they represent a significant community or a segment of a community. They were targeted because they have a specific reach within a hard-to-count community. Partnership has been directed to focus on these certain hard-to-count groups and gain partners that work well with that group. And an example would be targeting a nonprofit that works with low-income, non-English speakers. We would reach out to them and offer to give presentations to their staff or clients in order to get the word out from the quote top down. So we're oftentimes reaching into the high-level management of organizations and trying to let that message kind of trickle down to their staff as well, and then they can ultimately trickle down to the clients in the community that ultimately needs that information. Joining forces with these community-based organizations, increasing the range and the spread of the message, that was the ultimate goal. So the numbers were continuously expanding to reach an ultimate goal of 63,000 partners within the LA region. Each partnership specialist had metrics that we had to hit each month. We were continuously changing these metrics based on the need and projections to hit our region-wide goal. I believe when things kicked off in 2018 or so, or even earlier, partnership specialists were looking to gain 10, 15 partners a month each. So that continuously expanded as we brought on more partnership specialists, and we're able to expand our reach. And I think by February this year, in 2020, we were hitting well over 50 per month, 50 new partners per specialist per month. The number of 63,000 is proportionate to the population of our region, and that number was hit at the end of February. We achieved that goal. But overall, the CBOs are strong partners because they're the trusted voice from the community. Even though partnership specialists are typically working near an area in which they live, they are still seen as the federal government and unfortunately not seen as the most trustworthy at times. This is something I'd just like for you to consider when you're out there working directly with people. That's why we bring on these partners so that they can kind of be our trusted voice and the voice of the census. But I'll discuss some of the best practices a little later. Anyway, so partnering with high-level operators of these organizations allowed the Census Bureau to leverage the trusted voices of the community, again, letting the message spread from the top down. So, leveraging trusted voices. So respected spokespersons who can influence targeted populations to articulate the importance of the 2020 census and encourage self-response. Makes total sense. They're the cornerstone of the CPEP, the Community Partnership Engagement Program. Each of the CPEP elements that Allison discussed earlier, including the efforts of the trusted voices within the local community, those are what we were hitting on. Every one of those elements that she discussed is tied directly into having a leveraged, trusted voice on our team working to spread the message. 2020 census will include an additional focus on trusted voices to serve as census ambassadors, and that's happening and has happened consistently. These partners have often become members and often leaders of the CCCs, which is important to note as well. Many of them are the most enthusiastic and motivated partners. They've also taken up state-led efforts and received funding to open up their own partner-led questionnaire assistance centers, which I will touch on as well. The 2020 census is a collaborative effort between the regional offices and headquarters, where the regional offices identify the respected spokespersons and points of contact. The communities trust these individuals, and a wide variety of folks can be these trusted voices, including faith-based leaders, librarians, local grassroots organization leaders, local impactful leaders, and other recognizable figures. Leaders will be extremely important in communicating the importance of self-response, as well as portraying the options for self-responding, making sure that everybody's on page with how exactly this is going to happen. I did find a Gallup poll from 2019 that has a most trusted professions list. Allison, what do you think's number one on the most trusted list, the most trusted professions list? Do you have a guess?
Doctors.
Close. Nurses. Nurses is number one, followed by engineers, and then doctors, and then a variety of medical professionals. But also on the list were librarians and some other community leaders. And I'm going to touch on the importance of those a bit later as well. But So key partnerships begin at the grassroots level. The goal of all this partnering is to work with the entities to increase self-response in these low-response areas. And Allison touched on that extensively, so I'm not going to go too much into it here. But community organizations and local businesses, they were contacted to fill the gaps of areas of population that are not being covered by other programs of the census.
Could you maybe give a little bit, a few examples of like what a community partner might be? Maybe a couple of your community partners?
Oh, absolutely. So I am going to touch on that a little bit more extensive later, but they're a wide variety. The community partners are based on hard-to-count populations primarily. This next slide that's up right now, I'm going to talk about that, exactly how we did that. But, yeah, community partners, they could be your local DHS office, your Department of Health and Human Services. It could be a workforce office. It could be the local Goodwill. It could be anybody that has touch within a community and has the motivation to become a partner can become a partner. And I'll discuss kind of some examples of commitments a little bit later on how they partnered. That's really wide-ranging. You know, we kind of let our partners decide how far they want to take it and what they're actually willing to commit to as far as being an official census partner. So, yeah, I will touch on that quite extensively here as we move forward. But thanks for the question. So now I'm going to explain basically how we kind of moved about our staff assignments. This is kind of my experience in Oregon, and I know that the region-wide worked in a similar fashion, but I can't speak extensively on other states outside of my own. But yes, in Oregon, partnership originally focused on securing partners within certain geographic areas, and that was counties. So we took all the partnership specialists in Oregon and split up the counties based on where these partnership specialists lived. We began making contact with high-level county and city leaders and assisting in the construction of CCCs, although some were already had the census on their radar and had census task force already in place. Partnership then began to reach into other high-level organizations with wide reach within the county. And like I mentioned, you know, DHS offices, schools, universities, healthcare facilities, you know, specialized programs working with children under 5 or people with disabilities, you know, folks experiencing homelessness, a wide variety of different nonprofits and organizations that work with those hard-to-count populations. This model carried through the summer of 2019, and in the fall we switched to a hard-to-count oriented community-based organization statewide. So we had specialists that, rather than being assigned to a specific county, were now assigned a certain hard-to-count population, and they began to target any and all organizations in that realm exclusively. And I'll touch on kind of how they did that a little bit with each specific hard-to-count community. In December 2019, the rapidly growing list of partners began to plateau, and some other options were explored to boost those numbers so we could hit that 63,000 region-wide partner metric. This gave way to what is now famously referred to as the marriage. Many of you that were previously RAs, recruiting assistants, will be familiar with this, although it's worth noting that many of these marriages took on a variety of forms. Some were super happy marriages and some not so much. But my experience was fantastic, however, and both partnership and recruiting saw positive results. You know, I think that overall it was a complete success. And the idea was actually born when partnership began to realize that these ACOs and RAs were already making partners all around the region. ACOs were calling organizations and businesses and establishing contact to arrange training sites, testing areas, fingerprinting locations, and most importantly, places where RAs were actively performing recruiting efforts. So we formed small groups based on counties and based on where folks are working out of their ACO. And we created these mini teams between partnership specialists and recruiting assistants. The RAs would supply the partnership specialists with partner information, such as the organization, contact name, a phone number, and an email, in which partner would then enter into our tracking database known as CRM, which is a customer relationship management tool that the Census Bureau uses to track our partners nationwide. Partnership would then get credit for the partner, and we saw these metrics region-wide skyrocket. That's ultimately what led to us hitting the final goal. In exchange, partnership would assist the RAs in gaining access to certain organizations that they had previously struggled with. An example would be, say, a university who had initially told an RA that they do not allow recruiting or tabling in their university, but since a partnership specialist already may have had a contact at this university, we were able to reach out to them and explain the importance of being granted access. Partnership's contact at the university could then assist us in getting the door opened, so to speak, as well as, you know, another way that partnership kind of helped out the RAs on their side is we began mentioning and including the availability of jobs and the need within certain areas in all of our presentations. And, you know, at this point, towards the end of 2019 and through the late winter and spring of 2020, these presentations were numerous. I mean, we were having multiple presentations a day. So we were able to boost the RA's recruiting efforts as well on our end. So this was carried on basically right up into January, more or less. And then we kind of switched back to a geography-based model where the partnership specialists kind of moved back to their county specific. And we just did this so that there would be one voice from the census in those areas instead of kind of having a scattered approach. And this is where we're currently at, and this is where we're at as we begin to set up this MQA initiative. Questions on that, Allison?
No, I guess it's worth commenting that the marriage between recruiting and partnership in Nevada, especially at least in the northern Nevada area where I am, was really great. It was super successful. We were able to leverage some of their contacts and vice versa. I know down in the south of the state in Las Vegas, the RAs had a lot of challenges accessing some of the community centers as well as the libraries, which is really hindering their ability to get their message out to some of the people who would most likely be interested in jobs. But with partnership, they are able to, partnership was able to get into the libraries in the county a little bit better and spread that message. So I just want to kind of echo what you're saying is I don't know how it went in every single state or every single area, but broadly it was super effective, and I really have appreciated the opportunity to work with the RAs, future CRRs here, because I think more and more through the interactions with the recruiting assistants / CRRs, they're experts. They've been around a lot. Some of the folks have been around even longer than the partnership specialists, and the work that they're doing, I'm glad that it was able to get sort of amplified through this marriage, and I think ultimately recognized a little bit better.
Absolutely. No, that's a good point. I think that what it really did is it kind of streamlined the process. We kind of realized that we were almost stepping on each other's toes where, RAs would be calling a library and the ACOs would be calling a library, but the partnership already had that contact. So we just kind of drew it back. Let's let partnership kind of bridge the gap and smooth it all over. And it really opened a ton of doors in our region. And it really smoothed over a lot of our, some of the anxiety that some of our partners had been feeling by being touched by so many different partnership or census staff repeatedly. It kind of just streamlined it. And it was highly successful.
For sure.
Great, thanks. So some examples of some partnerships. So this is. I'm just going to kind of go through a couple really simple ones. There's such a wide variety of how partners have chosen to become an official partner of the census. But typically partners will use census tools, information, and messaging in creative ways to increase public participation. For example, sharing newsletter articles, co-branding products, using our social media posts as copy and pasting them and using them. The census also has an extensive page on their website called Outreach Materials, and that's just countless resources and toolkits available. I would really encourage all of you CRRs to give that a look, because you can look at things in different languages based on different hard-to-count communities. I think that I'm sending links to that outreach materials to partners many times a week when they're looking for, a specific, they're looking for a poster that's something specific in a certain language. You can point them in that direction. And that might come into play if we wanted to have some resources available for advertising the MQA or something like that. Another way would be hosting workshops and presentations to devise possible solutions to some of the challenges in the communities and generate commitments to tackle them. Similar to a CCC, but some partners kind of take it on internally, some of the larger organizations. Providing information to stakeholders about the importance and benefits of participating, for example, inviting the partnership specialist to speak to the audiences. That was one of our main objectives, was to get in front of as many people as we could and kind of spread the message. Another way is just encouraging people to work for the Census Bureau, promoting our jobs. That is huge, and it's going to get us to where we need to be once we enter into the non-response follow-up operation, which will be discussed a little later on in your training. Partners ultimately decided how much or how little they wanted to participate and what resources they would allocate to the effort. We left it up to them, and we kind of really wanted to make sure that they were comfortable in their choice to become a census partner. But
hey, Kevin, I've got a couple audience questions. One kind of harkening back a little bit, but so some CRRs they weren't RAs, and so they might not be so familiar with the relationship between partnership and recruiting in their areas, and they might not know, how the CCC has been working to promote recruiting or what the CCC has been doing. What can these folks who are new to the job, how can they understand the role of the CCC, and how can they understand the relationship between recruiting and partnership in their area?
Right. Well, they're gonna be trained. The way that it's going to work is the partnership specialist is going to ultimately be creating these MQA events, which the CRRs will then man. A lot of these events, once we're kind of firing up, are going to be at past events or past locations where we've had success with recruiting. And that's going to be libraries, work source centers, places where people congregate. So that's kind of what we're going over here, just so that they understand that there already is a relationship with these communities and these organizations. And I am going to touch on that a little bit here in a couple slides, just on some best practices on how those CRRs that aren't experienced being RAs beforehand might be able to go into a situation where that, it's almost like a cold call, where they don't know the contact, they don't know basically anything about how this is going to be. It's going to be such a fresh thing for them. But hopefully with this training, everybody can move forward comfortably together as one unified team. So, really it's just going to be continuing on with your training and then working closely with your partnership specialist who is setting up your MQA events. And, we'll be sharing all the information we have with you and letting you know all about the situation that you're moving into, so you can do so comfortably.
Okay, so it seems like working closely with your local partnership specialist will be helpful in getting some information and clarity. And then also,
absolutely. Yeah.
There's a question: will the partnership specialist work at the MQAs with the CRRs? Yes.
The answer to that is no, not necessarily. Although we're setting them up, we are going to be present at these. I think that, my plan is, and our team's plan here is to go maybe on the first couple, runs at a library and make sure, do those introductions between the library contact and the CRRs. Make sure they have the resources they need. I'm going to be sitting on piles of water bottles and posters and canopies and all sorts of things to make this stand out so people want to engage with us. So, no, we're not officially staffing them, but we will be there, on and off throughout the day. There could be multiple MQAs happening all around a partnership specialist territory that they might have to pop into one and then roll across town and check in on another one. But ultimately, you're going to be running the MQA booth on your own.
Cool. Thank you.
Yeah, no problem. Okay, next I kind of just wanted to touch about these community-based organizations and kind of how we've actually reached into these hard-to-count communities, and I'm just going to kind of breeze through them. Allison already touched on these, but I just want to kind of talk about this. And like she had mentioned, this is by no means a definite list of the hard-to-count communities. But faith-based, obviously it's a very trusted voice within a community. Partnership contacted places of worship for all religions. We included other faith-based nonprofits, such as senior living facilities, healthcare. There's a lot of different faith-based homeless shelters and faith-based ran food kitchens and soup kitchens type thing. The LGBTQ plus community. This is another very trusted voice within the community, just since they've been marginalized so much in the past. Focusing on the changes that were made to the census form, you'll become a little bit more aware of what's on the form as you go through your training. But this year in 2020, changes were made to the form to allow respondents to choose same-sex marriage or same-sex domestic partnerships. So it's important to share that information with these organizations, and we made sure to do so. We reached into college queer resource centers, nonprofits. We had a presence at festivals and events that serve this community as well. Children under 5, obviously working with nonprofits, daycares, various health cares, Department of Health and Human Services at a higher level. I learned that 5% of kids under 5 were missed in 2010. So that actually ended up being 1 million young children, which is the highest of any age group, which I thought was very interesting. So special steps were really taken to boost the numbers and participation, reaching those parents and folks that are the guardians of those children, making sure they get counted. We also reached out to low-income individuals and renters, targeting city initiatives, nonprofits, national assistance programs, working with women, infants, and children, like I mentioned before, DHS, food stamps, various opportunities to work with those populations and partner with them. Seniors were also targeted. We visited senior centers and community centers, events that were senior-based. They also played a very large role assisting with recruiting. We had a lot of recruitment done at senior centers, since that population is often interested in the job of the enumeration jobs. Also, we were hitting up living facilities, education. Now, we're going to touch on this a bit more later, but really just tapping into households through children, learning about the census, the Statistics in Schools program, which I'm impressed I said that without stuttering over my mouth. I think I trip up every time I say that. But the SIS program, yes. So Allison's going to touch on that more. She's an expert in that field, but we're going to get to that. Also, people experiencing homelessness. There's a wide variety of city resources and groups and nonprofits. Like I mentioned, shelters and food kitchens, food shelters and food and soup kitchen type setups. Immigrants, migrant, and foreign-born. There's a variety of associations. This was important, like Allison had mentioned, with the language needs of this particular group. Sometimes it was difficult for us to make contact, but we did the best we could to reach into those groups. They also played a large role in recruiting, and again, it's a very trusted voice. And the goal with these was to try to dispel the fear of the census. And that's going to be touched on more, absolutely, as your training goes by. Disability, folks with disabilities, reaching into states, resources, associations of people with disabilities, all sorts of different disabilities, developmental, physical, mental, learning, intellectual disabilities. Veterans, same thing. We were reaching into military institutions. These are all different community-based organizations that Partnership Specialists was specialized in reaching into. So a lot of our folks that have a past history with the military, they became the experts working with the veteran population. And we also work closely with the Department of Veterans Affairs. Healthcare institutions, sharing information with clients, They're far-reaching within the multiple hard accounts, and also just like we mentioned before, trusted voice. Same with first responders, police, fire. They're a trusted voice in some situations. And then corporations and utilities. We reach into them because they just have such a wide reach across society. Many, we could get them to send information out with their billing and envelopes and stuff like that. So just another example of how folks were targeted and some of the examples of how we've reached out to them.
Hey, Kevin.
Hey.
I've got another question. Do you have any insight as to why kids might have been missed?
Yeah, children under 5, there's a couple different reasons. One reason is that people simply forget to put them on the form. They just forget, and they don't put their child on the form. Another reason that I've heard is parents a child may be living in a situation, say they're living with grandparents in a senior living facility where they're not allowed to have kids that age, and they're doing so and breaking the rules of that living facility. They might be, the folks filling out the form might not include that child because they fear that the reprisal that could come back on them for that, and also, babies that are born, after April 1st are not counted. So, if a baby was born right on April 1st or before, they are counted, and after they're not. So, oftentimes, since the census is open until now, I believe it's August 14th, children that are born from April 1st forward are not counted in the 2020 census, and there's definitely a lot of confusion around that. I think that these organizations and partners that we're working with are doing the best they can to get that information out to those people so that they know that. And that kind of goes back to why we work with healthcare facilities as well. But yeah, I hope that answers your question.
Beautiful. Thanks.
Great. Okay, so I said I was going to kind of talk about, how general guidelines for working with partners, and this is going to be part of the CRR's training as well. I just thought I'd kind of throw it up there. This is kind of something that I personally have been working through as a partnership specialist, as a model. And, like I said, this will be covered a little more thoroughly. But, it's just really important to honor the relationship that's been formed. You're working with pre-existing partners, and we've been invited into their operation, and they've made special accommodations available for us to do our job, including advertising, which is really important for these MQAs, as well as providing, resources to us, tables, chairs, canopies, just the facilities of being inside on a rainy day and having access to a bathroom, stuff like that. So we want to work with them in a way that benefits everyone, and being realistic and flexible in the partner obligations is crucial. We just have to remain flexible. It's they're trying to do their job, but they're also just opening their door for us to do ours. So we got to remember that. All of our partners are different, and it's important to realize that what worked well on Tuesday may not work well on Wednesday, and this can apply day to day and at the same venue as well. So, we want to stay open to what partners are conveying. They may see success as something different than what you do. You're looking at how many folks you can get to do the census on your iPad. They're probably looking more at how many people are engaged and how many people are walking away from that as a positive experience. And also just let the partners decide how we operate within their facility. Remember that we're guests, and we want to be invited back. I just thought I'd kind of mention that. I know that's going to be kind of drilled in, I'm sure, a little later. But any questions on that? Anybody?
No, but yeah, I appreciate that a lot. I think it's important to remember that these partners are being extremely generous with us, giving us a platform and often giving us physical resources and their time, and they're allowing us in to their communities. So we really want to respect them, and I think that's an easy thing to maybe forget if you don't have that long-standing relationship. what you haven't seen is that sometimes these partners have been a real challenge. Sometimes we've struggled for months to try to slowly, get in good with a partner and build that relationship of trust. And so this has been a lot of emotional and just physical and time energy put into some of these partnerships, so to try to kind of remember that it didn't, that these are things worth nurturing and respecting. I think it's something that, yes, it might get said a lot, but I think it can't get said enough. So thank you.
Right. Excellent. No, I agree 100%. Moving forward, I have a slide on the state and elected official outreach. Honestly, this is, Allison, you covered a lot of this with your state CCCs, the early partnership operations focus on these high-level partners, meeting with governors and staff appointees and state lawmakers, mayor's offices. Many states and large cities had census teams formed well before outreach occurred from the Bureau. That's just something to keep in mind as well. But we came on board and kind of assisted and gave updates to the operational level of the census and offered guidance as well as, presentations about where we're at and kind of what our goals are with the partnership program. So I'm not going to get too into this. I'm going to focus more on kind of one of our higher level partners in regards to the MQA, and that is going to be libraries. Libraries, they're essential partners, obviously not just for the MQA initiative, but for recruiting, for events, and for the outreach. They have a reach. They deliver information about the census and host community outreach activities. They can provide internet access and enable respondents to complete the census online, as well as just being those trusted messengers. They're highly educated and an informed staff. Like, librarians are smart. I've been doing trainings with the library staff, kind of training them up. I'm going to talk about it here in a bit, but yeah, some of the toughest questions I've ever faced come from the librarians, and it's good stuff. So, the American libraries, they're ideal partners to help address the challenges that the census may cause for some people. They're trusted institutions, experienced collaborators, providing information, technology, and training resources to enable individuals to connect with the government for many purposes. The convenient presence in communities across the country, from inner city neighborhoods to remote tribal lands. Libraries can help census stakeholders reach a full range of audiences. They often work with public agencies to achieve community priorities. Library staff connects people with information they need to access government services and benefits, complete different online forms, engage with civic issues. So it's really only natural that people will turn to the library for help with the census. Providing the accurate information that's relevant to different users' needs is a central mission of libraries, so it makes total sense. Every day, libraries provide information to diverse groups of people, and all the different hard-to-count communities. They have a reach within all of them. Libraries can leverage this experience and wide community engagement to serve as trusted messengers and information about the 2020 census. They also have an extensive geographic presence. I mentioned in the slide here that 99% of all hard-to-count census tracts have a library within 5 miles. So, that is really important to us in understanding that why a lot of our MQA operations are going to begin here. But also the internet, accessible internet. I've read here that 24 million Americans do not have high-speed internet at home. That's according to the SCCC. But older adults, rural residents, racial minorities, and lower levels of education and income are less likely to have home broadband. So America's libraries are the leading source of no-fee public access internet. Just something to keep in mind. But with the response to the 2020 census is designed to take place primarily online, libraries can bridge the divide and support a more complete count. So how have we partnered with libraries? Libraries and associated county library associations have played a very large role in the CCCs. My experience in Washington County, Oregon, there's a library cooperative service it's been very positive. I hosted 6 different training events at various libraries where we invited library staff, school staff, and other community members to come and learn the ins and outs of the census. We were kind of training the librarians and stuff so that when folks come in there, there's going to be a variety of folks that are more or less experts on the census and can assist with that. Many libraries in Oregon have dedicated specific computers for census use only. Although they're all closed now due to COVID-19, many will have dedicated stations with the census website linked, as well as YouTube videos in all 59 available languages explaining the importance, ease, and safety of the 2020 census. They've also played a huge role in the recruiting efforts. Hundreds of libraries in the region have allowed our recruiting staff access to the library. It allowed them to interact with patrons and to promote the availability of those jobs. Like I said, I think when the MQA gets fired back up, I suspect that a lot of our first MQA sites will most likely be in libraries just for these reasons. But any questions about libraries, Allison?
No, I'll make a quick note. Yeah, we're doing all the same things in Nevada as well. The libraries have been great. We've partnered with all of the libraries in the major metro areas, and they've been immensely helpful. Just echoing that. But we've got about 10 minutes left on our presentation, so.
Sounds good. That'll work out. Cool. I'm going to touch on education facilities, and then I'm going to talk about the partner-led QACs, and then we'll be on our way. Thanks, folks, again for coming to our training.
Beautiful.
Okay, so actually, I'm gonna speak first about higher education. Allison has experience with the SIS program, Statistics in Schools, and she can share her insight on that real quick as well. But college students, this is kind of an operation where we reached. They just have a benefit from federal loans, that legislation and campus funding improvements and all these social services that come down the line from census numbers. So they're actively targeted by the census. They have a wide variety of hard-to-count communities mixed together, such as college students from low-income backgrounds, recent immigrants, first-generation students from homes who speak English with limited or no proficiency, homeless students or lack of stable housing, renters living on campus or off campus. So there's just a wide variety of communities built within universities. So we really tried to focus on that. And we had several partnership specialists that were working with colleges and universities throughout the state, at least in Oregon and I'm sure elsewhere. But our outreach activities focused on social events, social media posts, tapping into student resource centers, individual departments that may have a reach to a hard to count population. We partner with high-level, not only partner with high-level executives, but also with student governments, newspapers, student clubs, service groups, different ethnic groups, faith-based, sororities, fraternities, political action. I just kind of wanted to mention just that the higher education has a large stake in the census being a complete count and how they were targeted. But yeah, Allison, if you wouldn't mind just talking about the K-12, obviously the census has a wide reach with that as well. And the way we kind of initiated that was through our Statistics in Schools program. So if you wouldn't mind sharing just a little bit about that real quick, that'd be great.
Yeah, absolutely. So the Census Bureau recognizes that the schools are one of the best ways to reach our hardest to count populations. I mean, all kids are going to be enrolled in public or private schools, or more or less all kids. So this is going to allow us to, through kids, be able to reach into households who don't speak English or who are experiencing homelessness. All of these hard-to-count populations exist within the school system. So this is a great opportunity for us. I mean, and beyond that, beyond the ability to just be able to communicate directly and get sort of households engaged with the census, because parents are going to be helping their children with their homework and talking about their day, so if the kid's talking about the census, of course, that's one great benefit for the census, is why we want to get the conversation about the 2020 census happening in schools. The other kind of idea is that kids will eventually be grown-ups, and they're going to need to fill out the census. They're going to need to be engaged civically, right? So teaching kids about why the census is important both in the immediate and long term. But the Census Bureau has created this program called Statistics in Schools, which is this phenomenal group of resources, like learning materials created by the Census Bureau in partnership with a bunch of education institutions, teachers, leaders in education, to create lessons for students ages or pre-K all the way through 12th grade. And these are super high quality lessons across disciplines. So there's all these resources on statistics in schools, or census.gov/schools. You can check them out yourself. I'm not going to go super into it, but basically there's a bunch of different lessons for all different grade levels, all different disciplines. They're super easy to use, like prepackaged lessons with like the resources that teachers need, the kids need, all of it's there. All of it integrates census data and like helps communicate the importance of the census. And so what the partnership specialists have been doing with that is working with the school districts, with the departments of education, with teachers, daycares, even private schools, charter schools, all of that. Partnership specialists have been having meetings with these folks to introduce them to these materials and try to get these materials in the classroom. Most significantly, perhaps, for a program that we called the Statistics in Schools Week. So partnership specialists across the nation were tasked with trying to get all public schools, to participate in teaching certain 2020 census-specific statistics in schools lessons for like a week. And much of the country did this, the first week of March. It varied a little bit. I think California did it at a different date. Nevada did it. Actually, last week, they did this all through remote learning. So even the kids home with for the COVID-19 stuff, they're all learning about the census through Statistics in Schools program at home with their parents. So that was one really awesome way that the partnership specialists got to increase self-response. So we can move on to,
Fantastic. Thank you. That's great. One last slide from me, and this is the Partner-Led Questionnaire Assistance Centers. These have all been set up independently from the Census Bureau. So basically, we all work together, and a lot of these folks that are running these CACs, as we would call them, they're already members and partners of us anyways, and they're members of the CCCs, but they operate independently. Libraries would be a great example of a partner-led QAC, but other organizations in other states have had the opportunity to do this as well through state-initiated grants and stuff like that, as well as the state funding. This is a kind of a tough slide to convey since all the states have operated in different ways. But many states in our region have made funding available to community-based organizations in the form of grants to do specific outreach or a variety of other census-related activities aimed at getting the count. Many states have purchased advertising, offered specialized swag that is state-specific, and some have gone as far as establishing their own call centers and hired door-to-door solicitors to pass out information in targeted neighborhoods. Many of these operations have a name similar to what we have in Oregon, and that's the We Count Oregon campaign. In this slide here, I have tracked down the amount of, that each state in our region has funded towards those We Count campaigns and various other initiatives. Like I said, the variety of outreach is incredibly wide, but these operations are extremely important to getting the word out. And since the word is coming from a trusted voice within the community, we anticipate success. But that's pretty much what I got for us here. Do we have a little bit of wrap-up or questions, Allison? If you have anything else, you can add it in. This would be the time to do it.
One thing I'd like to add about the partner-led CACs is just for partnership or for CRRs to be aware that they exist, and that if people that they are slightly different. We're all working towards the same goals, but just know that they exist. That you might hear people asking about them or talking about them, but they are under a slightly different umbrella, and the people running them might not have the same level of knowledge about the census as you might. So to be aware of that. And then the other thing I wanted to include is just a reminder to all the CRRs out there. We talked a lot about what partnership does, but one of the key takeaways for you is get in contact with your local partnership team and find out who a good point of contact is if you've got questions. Your partnership specialists are really a great resource for you. Your RM might not have it is not their role or their responsibility to be experts about everything on the census or census outreach or partnership. That's not their responsibility. If you want to know the in-depth stuff, any specific questions about partnership or the census itself, please reach out to partnership. And that's all I've got.
Thank you. Great. With that, I think we will say farewell. Good luck out there, everybody. Thanks for coming.
Farewell.
Thank you for watching today's presentation. The recording will now end.